Hello and welcome to the topic Immunization Schedule in the Primary Care module. By the end of this session, you should be able to explain the aims of vaccination, identify types of vaccines according to age, understand the route of each vaccinations, identify the adverse effects of vaccinations, and manage children with delayed vaccination. Let's get started. In Malaysia, Public Health has outlined an immunization program for children since they are born. This is to make sure that they achieve objectives as below, which is to sustain high immunization coverage, which includes ensuring coverage for the unreached population, to reduce the morbidity and mortality due to these vaccine-preventable diseases. Malaysia has been practicing immunization according to a standard schedule as below. These are the vaccines provided at the primary care clinics. BCG, which is a vaccine that gives protections against tuberculosis, diphtheria, tetanus, and acellular pertussis, a booster dose for diphtheria and tetanus, Haemophilus influenza type B, the combination of measles, mumps, and rubella, which is known as MMR. JE is a vaccine against Japanese encephalitis, and this vaccine is only provided in Sarawak. And human papillomavirus or HPV vaccine, which is provided only for girls aged 13 years. Dose 2 is given 6 months after the first dose. By and large, there are three groups of vaccines, which are the live attenuated ones, inactivated or dead virus, and subunit vaccines. These vaccines are classified based on its mode of action and how they drive the immune response to generate antibodies. Let's look at them individually. As for live attenuated vaccines, the virus or bacteria is functional or alive but has been weakened so it can replicate in the body several times and generate an immune response without causing the disease. The BCG vaccine contains live weakened tuberculosis bacteria. After immunization, the weakened vaccine, viruses or bacteria replicate in the vaccinated person. This means a relatively small dose of virus or bacteria can be given in order to stimulate an immune response. Live attenuated vaccines do not usually cause disease in vaccine recipients who have healthy immune response. If a live attenuated vaccine does cause disease, chickenpox disease from the vaccine virus is usually more mild than disease caught from another person in the community. If administered to a person who has an impaired immune system response, they have leukemia or HIV, or are taking immunosuppressive medications, administration of a live attenuated vaccine may cause severe disease as a result of uncontrolled replication of the vaccine virus. Now let's take a look at the classes of vaccines. We begin with the inactivated or the dead virus. Inactivated vaccines do not contain live viruses or bacteria. Viruses in these vaccines are inactivated or split, such as polio or influenza vaccines. This type of vaccines can be safely given to a person with an impaired immune system response. However, a person with an impaired immune system response may not develop the same amount of protection after immunization as a healthy person receiving the vaccine. Inactivated vaccines usually require multiple doses. Some activated vaccines may also require periodic supplemental doses to increase or boost protection against disease. Hepatitis A, influenza, and polio vaccines are inactivated virus vaccines. Next would be the subunit vaccines. These vaccines present proteins or sugars derived from the disease-causing organism. Protein vaccines may include fragments extracted from virus or bacteria such as inactivated bacterial toxoid proteins. Pure polysaccharide vaccines are found on the outside of the bacteria, and some vaccines to provide against pneumococcal or typhoid disease. This type of vaccine can generate a protective immune response in older children and adults and cannot cause the disease. And then we have the nucleic acid base. At present, different types of nucleic acid vaccines are in development, preclinical and clinical evaluation phases, for the prevention of human immunodeficiency virus, influenza and malarial disease, and some even cancer treatment as well. Nucleic-based vaccines use the host's own cell machinery to make the antigen, which is then presented to the immune system. While RNA is encapsulated into lipid nanoparticles and injected, DNA is fired directly into the host cells using a brief electrical pulse. This vaccine platform is also being used to develop the vaccines that we currently have right now to prevent COVID-19 severe disease. Let's look at the routes of vaccination. So as you can see here in the diagram, there are 4 routes to administer vaccines, which are oral, intramuscular injections, subcutaneous injection, and lastly, intradermal injections. Adverse effects following immunization could be mild, moderate, or severe. A common side effect will be fever or rashes, but there are also severe AEFI, as you can see in the table below. Thus, this is why education to parents or caretakers is very important during pre-vaccination and post-vaccination. Immunization should be started on the first visit for children who have delayed visit to the clinic for immunization. Here shown in the slide is the suggested schedule according to the age for these children. Other than vaccinations provided by the government, there are also suggested immunization that are not listed in the National Immunization Program, such as the pneumococcal vaccine, meningococcal vaccine, rotavirus, varicella or chickenpox, and hepatitis A vaccine. So we have come to the end of this session. We hope it was insightful. Thank you for your time.